I have a very active lifestyle. I like to stay busy. I love sports, and so I usually have something going on year-round with that.
Mr. Falk's a very active father of young children who has hip dysplasia that became symptomatic, developing as hip pain for the last several years or so.
I really noticed that just even taking a walk with the family around the block, it would be painful. So it really started inhibited not just my sports, but everyday life.
What makes Mr. Falk's case unique are that in addition to the hip dysplasia, he also has some impingement in the hip, which causes very decreased range of motion in his case.
Once we determined that the physical therapy wasn't going to help my condition, we looked at surgery and what the options were.
Sometimes with hip dysplasia, we perform arthroscopic surgery to merely fix the labrum, to buy more time for the hip. Other times we're performing open surgery where we actually realign the acetabulum. In his case, he really needed both. I first performed the arthroscopic portion of the procedure. At the same time, Dr. Sierra also reoriented or did an osteotomy of his socket to improve his coverage. Our approach with the combined arthroscopic and open surgery is very unique. We're one of a few centers that can accomplish that around North America and the world.
The decision to have Mayo kind of care for me comes down to trust. It was kind of an easy decision for me.
When we choose a treatment plan, it not only involves the surgeons, but the physical therapists, the nurses that help take care of the patients after surgery, the whole care team.
It's pretty unique to Mayo, and it's one of the things that patients appreciate most is the efficiency and the communication and the fact that we are all on the same page.
I think our collective intelligence helps to provide more options for the patient to give them the best opinion.
I appreciated the collaborative team integrated approach. I was somewhat put to ease by the fact that I was at Mayo Clinic and you know they've done this before, and so I was in good hands, and I knew I was well cared for.
Hip dysplasia can present as hip dislocation in a newborn, and its more moderate and mild forms can present later in life. When we have an expertise or a specialty in a given area in orthopedics, we perform a high volume of those surgeries and become an expert in that particular area, which I think translates into better outcomes for patients. He's really doing fantastic. We really expected nothing less from him.
A big part of my life right now is getting down and playing with the kids. I'm looking forward to getting back to the point where I can you know, wrestle with the little guys and be able to do the things that I love to do.